What happens to your erection when you overthink during sex? Introduction. Have you ever found yourself overthinking during sex, worrying about your performance so much that it affects your ability to maintain an erection? This is a surprisingly common issue among men of all ages, particularly younger men who put a lot of pressure on themselves to perform well. But what actually happens when you overthink? And more importantly, how can you break free from this cycle? The psychological trap of overthinking. When men start experiencing erection difficulties, even once or twice, it can trigger anxiety. This anxiety builds up over time, creating a self-fulfilling prophecy where the mere thought of losing an erection makes it more likely to happen. This is commonly known as psychogenic erectile dysfunction, a condition where mental factors, such as stress, anxiety, or self-doubt, interfere with normal erectile function. Research suggests that 87% of men under 40 with erectile dysfunction have an underlying medical condition contributing to their problem. However, for young, healthy men, psychological stress is often the main culprit. The brain plays a crucial role in sexual function, as it sends the signals needed to trigger an erection. When you're anxious, your body enters a fight-or-flight mode, releasing stress hormones like cortisol and adrenaline. These hormones constrict blood vessels, reducing blood flow to the penis, and making it harder to achieve or maintain an erection. The vicious cycle of anxiety and erectile dysfunction. Let's break down how this cycle typically plays out. 1. You experience one bad sexual encounter. Maybe stress, alcohol, or lack of sleep caused a temporary issue. 2. You start worrying about it happening again. Instead of focusing on intimacy, your mind is consumed by thoughts like, "Will I get an erection this time?" 3. Your stress response activates. Your body perceives a threat, embarrassment, failure, and releases adrenaline. 4. Blood flow is restricted. Without proper blood flow, your erection quality decreases. 5. You confirm your fears. The moment you struggle to maintain an erection, your brain reinforces the belief that something is wrong. 6. Next time, you feel even more pressure. The cycle repeats, often worsening over time. How to break free from overthinking. During sex, fortunately, this issue is highly treatable. Here are some practical strategies. 1. Reframe your mindset about erections. One of the biggest misconceptions is that an erection should always be rock hard and instant. However, erections naturally fluctuate due to fatigue, stress, alcohol, diet, and even temperature changes. Understanding that minor inconsistencies are normal can help reduce unnecessary anxiety. 2. Shift the focus. Away from penetration, many sex therapists recommend taking penetration off the table temporarily. Instead, focus on sensory exploration, such as touching, kissing, and other forms of intimacy. This allows you to reconnect with your body and your partner without the performance pressure. 3. Seek professional help. If anxiety continues to interfere with your sex life, consulting a sex therapist or psychologist can be incredibly helpful. Cognitive behavioral therapy, CBT, has been shown to effectively reduce sexual performance anxiety. 4. Consider medical evaluation. Although psychological factors are common, it's still wise to check for any underlying medical conditions. Erectile issues can sometimes be an early warning sign of cardiovascular disease, diabetes, or low testosterone levels. Visiting a urologist or primary care doctor can help rule out physical causes. 5. Try short-term medication. Support medications like sildenafil, Viagra, or tadalafil, Cialis, can be used temporarily to boost confidence while addressing the psychological root of the issue. These drugs help maintain an erection by improving blood flow, but they still require sexual stimulation to work. What about adult industry myths? Many men compare themselves to actors in adult films, assuming that these performers have naturally superior endurance and size. However, there are several factors that contribute to their on-screen performance. Selective casting. The industry naturally selects men with above-average anatomy. Camera tricks. Angles and lighting can exaggerate size. Medical enhancements. Many actors use erection-enhancing injections, implants, or medication. Multiple takes. Scenes are often filmed over several hours and edited to appear seamless. The reality is that real-life intimacy is not scripted. Comparing yourself to these performances creates unrealistic expectations that can worsen anxiety. What causes a split urine stream? Some men also notice that their urine stream sometimes splits or sprays in different directions. This can be caused by leftover semen. After ejaculation, small amounts of semen can remain in the urethra, temporarily obstructing urine flow. Urethral strictures, a narrowing of the urethra due to scar tissue, infection, or injury. Prostate enlargement. In older men, an enlarged prostate can cause changes in urine flow. If a split stream is frequent or accompanied by pain, seeing a urologist is recommended. Conclusion: overthinking during sex can create a cycle of anxiety and erectile dysfunction, but breaking free is entirely possible. By shifting your focus, seeking professional help, and addressing any underlying medical concerns, you can regain confidence and enjoy a fulfilling sex life. Remember, intimacy is about connection, not just performance. If you're struggling, consider taking a step back, breathing, and allowing yourself to enjoy the experience rather than judge it. Understanding your body and how it reacts to stress will empower you to regain control and enjoy a more satisfying and stress-free sex life. So next time, rather than worrying about your performance, focus on the moment and let nature take its course.